All right, welcome back everybody to episode 3 of a series of conversations about peptides titled Low P. Everyone's familiar with low T, but did you know there's an actual low P? We'll talk to you about that. Welcome, Dr. Kris Wusterhausen.
Hi, Steve. How are you today?
I'm excellent. So we've been having some really good conversations about how physicians can start to really, well, give a boost to their practice by considering to carry these peptides. And in these conversations, I'm really getting excited about it because no one really discusses being low on your peptides, how it's something that you're born with, but over time, just like testosterone, you start to, as you get older, you produce less and less. And it would make sense that you would produce less peptides. Let's talk a little bit more about low P and overall how it impacts us as we start to age.
Yeah, so I mean, you kind of hit the nail on the head, and it's actually something that I've kind of started thinking. I didn't actually think as a provider prescribing peptides about this until the last maybe like 6 months. I actually saw some slides and how really it hit home how a lot of these peptides that I prescribe and that other peptide physicians are prescribing are actually bioidentical, made in the body. And they deplete just like our hormone levels deplete. Like I always tell my patients, I always say, unfortunately, we're not like wine. We don't get better with age. And, like a lot of times when I'm talking about specifically like maybe thyroid hormone, you know, I used to have this thought, and a lot of physicians still do, that until it hits bold print, we don't treat. In other words, in English, unless it has an H or an L beside it, we're not going to treat it. Instead of actually looking at the number and saying, oh, you know what, your thyroid function is the bottom third of normal, and you're 48 years old, like in my occasion, and you know that, unfortunately, at 52, it's not going to somehow get better. Except for those rare circumstances where you have something that you can reverse. For the most part, it's a downward trend. And then I was at a lecture. It was a Dr. Seed's lecture, and they threw up some slides that actually showed the depletion of peptides, and it was kind of like one of those moments. You're like, oh yeah, peptides deplete just like hormones deplete. Because you've heard me say it in these podcasts before. We were meant to be born, replicate, and die. Fortunately for all of us, we're living longer, but our hormones and now we know our peptides don't always hang in there with us to those optimal levels. So yeah, that's kind of how I look at peptides and hormones in my practice.
Yeah, that I always think about our default thinking is we need to get some sort of medication to address symptoms or hopefully try to improve the way that we're feeling. But what was really interesting to me is you talking about these peptides that we're just not producing as much, but when you start to supplement those peptides with peptides, then it's amazing how remind me of the name of the age test that you give?
There's two different ones, Chronomics or True Age. True Age is the US version. Chronomics is the one out of Europe. We've been using True Age. We've been looking at Chronomics. They're both very, very good tests, give you very accurate biologic ages. True Age uses like nearly 900,000 snippets. Chronomics uses over 2 million snippets. One's more costly than the other. You can probably figure out which one is more expensive. So the True Age is, in my opinion, a very affordable test. Chronomics, it gets decently expensive. We've been looking at it. We may add it to the practice, but right now we're using the True Age. Either one is a great indicator of biologic age for patients to really get a feel of where they're at with their health.
Yeah. So, you just think, I'm not what I used to be. I still want to be impactful. I still want to be active, but there's just days that I'm a little bit sluggish, or maybe I don't feel I'm as clear thinking as I like to be. And it's exciting to know that there's an option that would be with very low side effects, that maybe isn't some medication I need to go and take every day. You know, there's a medication called modafinil, which is a way to, I've seen these series or documentaries about people taking those to have better attention span or concentration. And it just seems like this would make more sense that you would want to go to this first. And it's something that your general practitioner would have less heartburn over prescribing.
Well, so many of, one of the common scenarios that we're presented with in my office is executives having issues with brain fog,
Mm-hmm.
and or they might say attention deficit disorder type symptoms, and it's something that we treat a lot here. And stimulants can be effective in those patients, and that's what you were speaking of a second ago. And there's some different routes to go about that, but those medications many times do have some fairly significant side effects. It can really affect appetite. It can affect sleep. It can make your heart race, elevate your blood pressure. I mean, those are some things that they can really do. And many times we can just go, I think there's just more patients looking for a more natural approach to these things. And like I always say, like I always make a joke about antidepressants, and I don't mean this bad. I certainly I still prescribe antidepressants. I still have patients on them. But as I always say, we don't have a Lexapro deficiency in our body.
Yeah.
Now we truly may have serotonin issues, and that's where those medications come in handy. But many times, if we just balance hormones and look at some specialized peptide therapy, many times we can help these patients. I had this discussion with a patient just yesterday who's dealing with some depression issues, and he actually came to me. He knows me, but he came to me because he doesn't want to go the traditional route. He either had an appointment or went to a doctor who wanted to prescribe some heavier duty psychiatric medications, and he's like, I just don't think I need those things. There's bound to be something else. And I look at his labs. He's got low testosterone. That's a factor. And I think that 2 or 3 maybe different peptides in his scenario. Time will tell, but I think there's a good chance that we can, with a more natural approach, getting back to feeling like he felt a couple of years ago. It's getting harder and harder for executives and, well, just about anybody in business these days. We're doing more and more. I mean, this.
Mm-hmm.
We're all trying to multitask, which I read something good the other day, which is there really is no such thing as multitasking. We can only do really one task at a time, but we just have a lot of tasks on our plate that we're trying to get all done at once. And so
Yep.
I think all of us kind of struggle with this and how to go about it. And what's nice for providers is that this gives them options for those patients. It's not for every patient that walks through my door, but for those patients that, despite proper nutrition, proper exercise, hormonal balance, still have some issues. Before I used to just kind of like go, I don't know, like I've done everything I can here.
Mm-hmm.
And so it's nice just to have a few more tools in my toolbox. Unfortunately, some patients, I wonder if anybody can fix them, but, it's much more rare that I run into that these days. I think we always have different options for these patients that they're just happy that someone's really diving into their health, showing them something different, and really trying to get to the root of the problem versus just here's a medicine. I always call it like, paving potholes, just throwing some more asphalt in the hole and hoping that fixes it when we know good and well it's only going to fix it for a few weeks or months. And so that's just kind of how I like to look at it.
So what's interesting on these peptides is it's not one peptide, one specific condition. Now, you may think of that peptide for a particular condition, but often these peptides, they also improve other things that your body may need some more peptides for. So, for example, I was reading through some of these. This BPC 157 is one that caught my eye because a lot of people, they're wanting to be more active, but they injure themselves as they get older. And so there are certain things like, you might damage your knee or your elbow lifting weights or something, and then you have to sit and be dormant until those things heal. But this one here in particular, not only, well, tell us about it instead of me represent it wrong.
Well, I like to start with actually just a follow-up I did yesterday afternoon with one of my patients. And this is a gentleman that came to me 3 or 4 months ago. He actually, from a pretty good distance away, he found me through the internet because there just aren't a lot of people doing peptide therapy. And so he travels about an hour and a half or so to come see us. And he actually came to me because he had a significant right rotator cuff injury. He's right-handed, and he's a golfer for a hobby. And he wasn't able to do more than about 8 to 9 holes before his shoulder would get so fatigued and sore that he couldn't go any further. So he came into my office because he wanted a consult. He had actually done his own research, which is really cool these days. Patients are coming to me, have already done their research, which is just amazing to me. But anyway, and he was interested in BPC 157. And a sidebar, after we got to talking to him, he actually had inflammatory bowel disease called Crohn's disease. And so we got to talking, and BPC 157 has a couple different routes. It can be injected, or it's actually one of the few peptides. It's also oral. And so we were talking, and he didn't, at the first visit, really understand that BPC is a multi-use peptide. It's actually made in our gastric lining of our stomach, and it can be used for, in my practice, I use it for anti-aging. I use it for ligament, tendon, and bone injuries. I use it for multiple neurologic disorders, and I use it for multiple gastrointestinal disorders. It's great for like GERD. It's great for just that person that has irritable bowel syndrome. Those can be really difficult patients for our primary care or just physicians in general to treat, even the gastroenterologist. So what made this one kind of interesting is he actually has a gastroenterologist for his Crohn's disease. He actually went and saw his gastroenterologist after we talked, and his gastroenterologist actually was enthused by what we were going to do and actually was excited to see the outcomes. He actually is following up with a gastroenterologist who's doing a 6-month follow-up today. So I'll be curious to see what he says. Anyway, the point of the story is Scooby-Doo forward to yesterday, and I talked to him, and he says, I play 18 holes without any issues. My shoulder doesn't bother me. My range of motion is good. He said he's actually, when he does like walking for exercise, he'll use weights and actually do some of that while he's walking. And he just is having no problems with his shoulder. He did say that he was remodeling a friend's house and going up and down 2 stories, and now he's got a sore knee, so he's now moving the BPC over to his knee. But I said, so how's the Crohn's disease going? And he said, you know what? I totally forgot about that. I haven't had any issues with my gut in months. And he goes, and that's not the way it was before. So he was going to his gastroenterologist today. His gastroenterologist has said that he was going to re-scope him. And so I don't know if he's going to plan on doing that in the next month or so, but actually to go in and look at the colon mucosa to see if he saw a more healthy mucosa. So I'm excited, hoping the gastroenterologist follows through so we can get some objective data there. But that's just a great patient. BPC, I started a lady on it yesterday who came into the office for hormones, and she'd had a left rotator. She's right-handed, but she'd had a left rotator cuff repair 4 months ago, and has had a difficult young lady in her 40s, early 40s, but that's young to me, Steve. It's funny how it seems younger and younger, but she's had a complicated post-op course, and she's been released from therapy. She's been released from the doctor, but she says, my shoulder hurts more than before I had surgery. So we talked yesterday about BPC, and she is starting it. We've ordered it for her, and hopefully be starting it today. She's going to come back in a month and tell me. And what I tell patients that have musculoskeletal issues is give it 30 days. If it's not better in 30 days, then BPC is probably not going to be the key. And you'll be amazed. I rarely have anyone that at 30 days doesn't tell me that it's either not resolved or tremendously better enough that they want to reorder for a couple more months. BPC can be used long-term. It's not something that you can only use for short periods of time. Like I said, I use it in my cell senescence protocol. So I have some patients just take it indefinitely. The big question that we have sometimes if we're going to use it orally or if we're going to use it via injection, I really recommend the injection more for musculoskeletal. We actually have them subcutaneously injected at the nearest site of the pain. So like right up under the skin and the shoulder, knee, ankle, wherever we're trying to heal. But the oral works great for the neurologic disorders. We've had a lot of good success with helping slow down dementia, Parkinson's. There's a lot of data out there with like multiple sclerosis and neurologic conditions like that as well. So it's just an all-around great product. It's safe. It's bioidentical. We make it already in our body. It's just a great peptide.
Talk some more about the neurological application. That seems fascinating to me, that there's a certain deterioration going on. I cared for a friend of mine for a long time who had dementia, and it got worse and worse. And there were so many things that they experienced during that process. And it would have been nice to have something to slow it down or to, it just was awful to watch them go through all the things that they experience.
Yeah, dementia probably is the disease that I personally fear the most for myself. Luckily, I don't have any dementia in my family that I know about. My wife has significant amount of dementia in her family. And, with my other jobs that I have done working in long-term care facilities as well, dementia is just such a debilitating disease for the patient, but even more so for the family and loved ones. It's just a horrible disease because you slowly watch your loved one go away, but the body stay behind. And I just, some of these people can live decades in a demented state, and I just think it's horrible. I would not wish that upon my worst enemy. I just, and what makes it worse is there is very few, I guess is what I would say, great treatments in the traditional realm for dementia. All we do is basically throw Aricept and or Namenda at these dementia patients. We haven't had a new dementia drug of any substance in gosh, I don't know, decades. And so we basically tell these families, sorry, this could be fast, this could be slow. Let's just see what every day brings. And they watch their family member just wilt away in front of their eyes. So like one of the examples I used with BPC early on, this is one of the things that actually got me cemented in peptide therapy. And this was a few years ago. And it was one of my very close doctor friend who also does peptide therapy. And I took care of his mom. And his mother was in her upper 80s, and she deteriorated extremely rapidly from oriented times 3 to oriented times 1. She went from a fairly normal state to a fully demented state in just a matter of a few weeks. So much so that we had to put her in a memory care unit. I was having to medicate her with antipsychotics to put her to sleep. She was staying awake for days at a time, 3-4 days at a time, seeing things in the corner, accusing her poor 90-year-old husband of having an affair with my nurse practitioner, things like this. I mean, it was just horrible for the family. And we got together and we decided to start her on, BPC. And at that time, unfortunately, we don't have this peptide any longer, but it was called RG3 or synapsin. We used synapsin and BPC with her. And she went over a matter of just maybe a month from demented to oriented times three most of the time, knew her loved ones, hallucinations went away, antipsychotics went away, and she lived out another year and a half or so from, unfortunately, she had a stroke at 90, but she lived out the rest of her life in a fairly normal state, at least compared to what she had before. And we actually, my doctor friend did multiple videos with her, and he presented her case at a age management medicine conference, April of 19. And it was one of the most beautiful videos, but sad videos I've ever seen at once, because she knew what was going on, and she talked about her experience with BPC and how great it was. And at the end, she said something that still kind of haunts me right now. And she said, "You guys need to figure out a way that all these other people in my facility can be on this product. And why can't they be on this product?" And it was just kind of soul crushing, because she's right. You know, like, here's all these other people in this. She did stay in a memory care unit, but she was a high functioning dementia patient in the memory care unit after we got her treated. And he had the physician had to give it to his dad, who would sneak it in and give it to her every day, because she was taking oral BPC.
Yeah.
And he lived in the assisted living, so he'd go see her every day and give her the pill, because the doctor there wouldn't sign off on it.
Right.
And it was just, you know, it was just one of those horrible situations where here she is getting better. No one knows why except for us. And then, but the people there, the other people don't get access to this. And that's the one thing that's really negative about this, is that, you know, it's not mainstream enough that, you know, a lot of families are going to sign off on it, because they're just, you know, unfortunately in America, so many people, if they can't go to CVS or Walgreens and get it, they're just against it. And if the FDA doesn't completely sign off on it, they're against it. But the good news is, for physicians, for providers out there, is so many more people, though, are gosh, I nearly want to say anti-FDA, but I'm certainly not anti-FDA, but some patients are. They're kind of like, well, they kind of like it that the FDA is, you know, not saying no to it, but, you know, is not mainstreaming it, I guess is what I'm trying to say.
Well, it feels like to me the peptides feel more like you can create a formula that's unique to my needs, instead of the one size fits all FDA approved pill with the recommended daily in dosages or whatever. I understand why the reasoning behind that would be there, but we're all different, and we all have compounding issues that are different. And it seems like it stand to reason why treatments like this would be a nice augmentation that would feel more tuned in to what I need, and help me avoid the things that can be avoided.
Well, it's generally what I think is separates this field of medicine that a lot of us providers are in, age management medicine, or is the preciseness of it. You know, a lot of people call it precision medicine. I don't know if I like that term or not, but it does make some sense. It's, you know, instead of using a shotgun approach, we're going to be very precise and exact in what we're trying to do with our patients. And I just think that's where peptides they're the future of medicine, in my opinion. I think everything points that way. Peptides are here to stay. Physicians in 10 to 12 years, I think all physicians will know about peptides. It's just, how quick do you want to get on the bandwagon? Do you want to be in front of the curve or behind the curve? So, you know, I can't speak highly enough about, and we're just hitting some of the major peptides. I mean, these peptides, there's so many different ones. And I think you said it early on. The one thing I try to, when I talk to providers, is this is something that, as I've been working with more and more providers, because as I had told you, I'm working with a few hundred providers now, is everybody likes protocols. And so when I talk to these providers, like, give me your protocol for this, give me your protocol for that. And as I say, I use protocols, but they're just to start with. And then, if that works well, but not well enough, or it doesn't work at all, then it's about actually just using our brain and saying, okay, this peptide does this. And I think that that's probably the problem here. Let's try it. And the great thing about using peptides that I harp on all the time is I feel comfortable that I'm not going to harm them. And the worst thing I can do is 30 days, we try something. Well, that didn't work. Okay, let's back up. Let's try the next thing. And there's just so many different options. But the good news for providers going into peptide therapy is, even though there are a multitude of peptides, you can do so much good for your patients with 5 peptides, 4 or 5 peptides, and implementing that into your practice. And, you can help so many more of your patients, and they're going to be so happy at the end of the day. And you're going to be happy because you're seeing improvements, which is what, as providers, we all want to see.
So the sort of the theme of this is, all right, we have the cell, tell me if I'm pronouncing it right, senescence?
Senescence.
Senescence?
Senescence.
All right.
Cell senescence. Uh-huh.
All right, going on. Then where our body is this cool machine that likes to repair itself.
Autophagy.
Okay, and then being able to just replace these peptides is complementary to both of these processes that already exist in your body, and so where it feels congruent with the code of the physician, right, to heal. So even though we've covered it a little bit, let's review the 2 things there, though.
We'll expand it to 3 if that's okay with you. So there's
I'm in.
three major things I like to talk about with a cell, and that's, as I like to tell my patients, and I'm just going to for a provider that may be listening at some point, I'm just going to talk as if I'm talking to my patients. And I always say, basically what we're doing here is we're going back to cellular function.
Mm-hmm.
If we make all the cells function highly, if we make them communicate together better, ultimately we end up with a healthier patient, okay? And it's hard for anybody to argue with that. I mean, it makes sense to, I think, from doctors all the way down to just a layperson. You mean if my cells are functioning better, I'm going to do better? Yes, okay, I can buy into that. And where all of our problems start at a cellular level, and it just builds from there. So there's 3 major kind of cell phases or cycles, and one's called apoptosis. So that our cells are obviously extremely bright. I always joke with my patients, say, no matter how dumb you think a person is, their body is extremely bright, okay? And so cells sometimes know that, I can't be repaired. I am malfunctioning. I need to go, and they commit suicide, and that's called apoptosis. Okay, so that's basically a cell killing itself off for the good of the host. Okay,
right.
And then autophagy is the phase of basically a cell realizing that it is malfunctioning, but it is still repairable. So that autophagy is the phase of basically the cell repairing itself. And unfortunately, that autophagy, as we age, can start to get a little wonky, I like to always say, and it doesn't repair, but it doesn't commit suicide, and it basically hangs out. It's not doing its proper function and can eventually start causing problems. I like to use the term that I was taught, zombie cell, and ultimately that's called cell senescence. Okay. So cell senescence, we like apoptosis, we like proper autophagy, we don't like cell senescence. And a lot of people believe, as I do, that cell senescence is basically what's behind aging. Because aging now is an actual diagnosis. It's an actual disease, aging. And some of us are aging more rapidly than others. And I believe that most of us that are aging more rapidly than others is basically because you have more cell senescence than others. Naturally, how do you help with cell senescence? You eat right. You try to keep your stress level down. You try to exercise well. Then you move into drinking plenty of water. You move into trying to keep your hormones balanced. And then from there, you move into peptides. And there's, when we go back to cellular function, we're not only trying to make sure these things work well, we want to make sure the mitochondria, which is the power plant that makes ATP is what we use as energy in our body. We want to make sure the mitochondria are functioning well. And so there's a lot of diseases that mitochondrial dysfunction, we believe, is behind it. So there's just a nearly endless amount of different ways that you can attack a patient these days with peptides. And what I love is getting together with other peptide physicians and say, how do you treat this? And sometimes you'll hear things and go, oh my God, I never thought of that. And so it's really cool because this is the only area of medicine. Like when I went to medical school, basically you learn a disease and you're told this is how you treat it. And you really can't venture off of that. Oh, you might, like high blood pressure, you might get to choose, do I want a calcium channel blocker? Do I want an ACE inhibitor? But ultimately it's like disease X, treatment Y. And that's basically how you learn protocols, okay, if you want to do that. Yeah. Peptides, you actually get to use your brain. You actually get to think about, okay, what pathway do I think is causing a problem here? How do I think I can how can I help this person? What can I try now that it hasn't been tried? And it's fun. It's kind of like nearly like a jigsaw puzzle or something in that nature. It brings, in my opinion, a little bit of excitement back to providers and their treatment versus, okay, I've got condition X, treatment Y. And I love hormone replacement, don't get me wrong, but it's, I've got low testosterone. I do this, I can do it in my sleep. Okay. I mean, but I like it. I'm not saying I don't, but I don't stay up at night trying to think about a new way to treat, low testosterone. I know how to treat it. So That's what just kind of separates it and makes it really cool for the provider.
I like that. So we have these smart cells, and how cool to have smart doctors working together with the smart cells to extend our optimum health. I think about the things that the days that I don't feel good is like, really, that's a downer. When you feel great, you don't think about it. You're engaged. Mm-hmm. You get to focus on other things. But when you don't feel good, it's like really we don't realize it until we start to kind of wander into that not feeling good, how we miss feeling well.
Sure. I mean, it disrupts your whole day, but the difference I think though that you experience versus some others maybe in our age range is that a lot of people don't realize how bad they feel because they haven't felt good in so long.
Wow.
You're already engaged in age management medicine. You're eating well, you're exercising, you're hormonally balanced, and so many people have none of those things. And it's always amazing to me sometimes. Like a lot of times, I'll get a patient through their spouse. They come see me, they start doing well, and they just basically force their husband or wife in. They're like, you're going in to see him. And I'll go in the room and I'll be looking at their labs going, oh my God, this person must be like in a horrible fatigue state. And you're going, how do you feel? Oh, I feel good. I'm like, no, you don't. They just don't know. And then hopefully if they buy into what we do, and then in a few months they come back and you just see the different look on their face. Like I saw a patient yesterday in follow-up and she just looked like a different person. I mean, it was just amazing when they come in, and it's like, and sometimes I think they're thinking we're pulling their leg because I'm like, you look so good today. And I said, and I don't mean that to sound bad. You just look so good today compared to what you looked like before. And, it's like reversing the clock. This lady was 72. And it was like we took her clock back 5 years just cosmetically, and no cosmetic procedures done. We do that as well. It's just how much better. Because if you feel better, you act better, you look better.
Your eyes are bright.
Yeah, I mean, I didn't sleep real good last night. Just one of those nights. I have one every now and then. I had a lot on my mind. I had a lot of different things going on. And I woke up this morning and it's been hard to get in the same groove today because of just getting, not a great night's sleep. It's just that simple, and it happens to a lot of people, but so many people are just accepting of, well, I'm 50 years old. It's just, if I could tell you how many times I've heard, how do you feel? Well, I feel okay, but I am 50, so I'm supposed to feel this way. man, the hell with that. I just don't subscribe to that theory. I'm 48, and most of the time I feel better at 48 than I did at 35 whenever I wasn't doing the things that I do now. Do things hurt a little more sometimes? Sure. But I don't, try not to let that stop me. So luckily I've got a lot of patients that feel the same way.
So one of the benefits of peptides is to help you sleep better.
Yes.
Would you agree that you would be less grumpy? And all this conversation today has been around the age management or older. And so I do want to acknowledge this is not just for this age opportunity, but yeah, let's talk about resting and being grumpy or being a little bit short.
Yeah, just sleep is one of those things that a lot of us start off sleeping well, and as we get older, and yeah, you're right. We can treat a wide array of ages. Most of our practitioners, you're going to be in that 35 plus age range with most of these conditions, but we certainly could treat younger if we chose to. But sleep is one of those things that kind of starts to alter with age as well. And, I tell my patients a lot of time that come in and I'll ask them, how do you sleep? And, these days, like I have this cool thing called an Oura ring, O-U-R-A. Like actually I should have bought stock in this company. I've been using them for a long time. And the NBA has every player, every coach, every team member that wears an Oura ring. And Oura rings monitor your heart rate, your temperature, your pulse. Pulse. It monitors your sleep cycles, your sleep phases. And so nowadays with these cool different monitoring systems, you can actually wake up in the morning and actually get some data on how you sleep. And I think that's really beneficial to patients to see, man, I don't think I slept very good last night. And then you look and go, crap, look how bad that sleep score was last night. And then you can sometimes start kind of digging into why you're having poor sleep. And sleep can be difficult. It's one of those conditions that sometimes makes me scratch my head a little bit, but we're getting more and more options for sleep. But yeah, peptides, CJ-cipamorelin, you give it at bedtime, have that boost of growth hormone while we sleep. It helps us go into the deep phase of sleep easier and longer. You just get more restful sleep. A lot of us, it's not necessarily that we need more sleep. We just need better quality of sleep. Most of us can get away with 6.5 hours of sleep a night. It's just how many times are we awakening and are we getting down into that REM and deep sleep? And so many people aren't. And a lot of patients have sleep apnea. That's another thing that's easily screened for these days. You can do these home kits now. You don't have to go to the sleep lab any longer and be stared at all night, which is kind of nice. And that's something that's very easily rolled out in our patients. I always thought that was kind of creepy to go with a glass wall and let people stare at you all night. I was like, I don't think I could sleep with somebody watching me.
Exactly.
But anyway, you don't get a good night's sleep. You wake up grumpy. Your day goes grumpy. It's just the way it is. Low T does the same thing. There's so many, I always say like energy, and if I'm going to call grumpiness, I'm going to say energy, just feeling good. It's not as simple as like, here's the one cause most of the time of why you don't feel good. It's usually like a little bit of this, a little bit of that, a little bit of that. And sometimes patients say, well, what's the percentages? I don't know. I'm just going to fix it all and we'll see where we're at. And generally, if you'll fix it all and if the patient will just help you a bit with proper nutrition and exercise and stress reduction, boom, you get great outcomes. And the one thing I tell providers that if they're ever thinking about kind of going into age management medicine is the nice thing is we naturally attract patients who want to get better, to come spend their own cash out of pocket, to really seek out these therapies that are a little bit off the beaten path. They generally want to get better. I think I may have told you this in one of them, that's what kind of pushed me out of traditional family practice was just like, give me another pill, doc, and they still smoke a pack, drink 12 pack a night and eat ho-hos all day long. And it's like, crap, I'm never going to get this person any better. I'm just going to throw another medicine at them every time I see them. I just don't like that medicine. God bless doctors that do it. I'm not knocking it.
Yeah.
It just wasn't for me long term.
So maybe this is I want you to talk a little bit about it. We're kind of getting towards the end of this conversation, but maybe there would be a good episode to really discuss this. But to me, it seems like medicine was kind of really man oriented, and it, we talked about a pill being a one size fits all across, but then that's just assuming everybody is in a male orientation, if you will. But actually, a woman's body is very different, and it needs a whole different set of perspective addressing it. I'm thinking that this would be an excellent way to really work with women and women medicine uniquely, and have a lot more options than what already exists in this kind of a man-oriented medicine.
Well, I think my response to that would be is in some cases, things absolutely need to be specific for women, and sometimes it's very similar than a man. But what I think really happens is kind of naturally, I always joke, but when I talk to providers, they're like, oh God, this lady's coming in. Ladies are kind of seen by providers as being more complex, more difficult, and they can be, but I think it's a good thing. Generally my practice is slightly more women than male, female versus male. I enjoy the complexity of treating my females. And you're right, with some of these things, it's just, again, giving them more options. I don't really even know if it's so much male versus female. It's just this person versus that person. In other words, just because it's Steve and then Sam walks in, I'm not necessarily treating them exactly the same. And that's where sometimes I get a little frustrated with some, even in age management medicine, is that these protocols, some providers think, well, I just use them on everybody. And well, it's a starting point. Okay. You got to learn somewhere and you got to start somewhere, but you still got to use your brain. You got to listen to your patients. The most important thing is, what I really love about my job is I'm no longer bound to like 12-minute visits.
Yeah.
And, when I was in traditional family practice, we booked them every 15 minutes, and many times we booked 2 every 15 minutes. And that was including charting and everything. It was impossible to do. And so I never really had the occasion to say, tell me about what's going on, and actually just shut up for 10 minutes and let your patient talk. You'll be amazed at what you'll learn from your patient if you'll just be quiet and just let them tell you their journey. Unfortunately, some will go on for an hour, but most give them 10 minutes. And first of all, it's probably the first time in years they've been given 10 uninterrupted minutes to talk to a physician. But they'll lay everything out that's bothering them in 5 to 10 minutes, and then you can really start hammering it down. And it's one of those little tricks I found, and it's hard for me because I love to talk. Is just be quiet, let them talk. If nothing else, they feel so much better that somebody literally for the first time actually just let them talk. Because as providers, we're generally always cutting patients off, asking very specific questions that we feel are important, but maybe the patient doesn't. And you just, in traditional medicine, don't have that ability.
Yeah. Yep, that's true. So maybe I'm a physician listening to this. Maybe I'm a women-centric provider. How should I maybe contact you and start exploring supplementing my practice or my what I'm doing with through you, or maybe
so it's just as simple as you can start by going to our website, theresurgeclinic.com, and my email is just Dr. Kris with a K at theresurgeclinic.com. Be glad to do a Zoom meeting or a phone meeting with any physician that just has interest. At this point, I'm just happy to expose other physicians to what we have going on in peptide medicine. When I started training other physicians, I originally had this moment of hesitation of, do I want to train my neighbor to do what I do? And I had this hesitation. And then I was talking to another physician that had a similar thought. And he's like, man, you'll be amazed at when you just start getting the word out there, there's no end to the patients. So you can't oversaturate your area. You're not going to, it's just, it can't be done. And so I just want more and more physicians to know about this. I think that as more and more doctors band together with this type of medicine, we're only going to be able to drive the prices down of peptides. That's the one thing that I hope in the future, because sometimes peptides can be cost prohibitive for some patients. If I took the regimen of peptides, that if most of my patients took the regimen I wanted them to take, it could be $2,000 or $3,000 a month. So we have to really look at it and be economic focused on what we want. But I just think that if we're in numbers, we can do more good. We can drive prices down. We can make this more mainstream ultimately, which it'll get there eventually, but we can speed that process up. You get more play with the FDA if you're in numbers. I just think there's no negative to more and more providers doing what we're doing.
I love that. It feels a little bit like a movement to looking to your doctor to help you really understand your body more, and to figure out how to help your body heal itself. So that's exciting to me. So low P seems like a positive movement for people to know about.
Absolutely. Couldn't agree more.
All right, Dr. Kris, great conversation. You guys stay tuned for the next in a long series of excellent things about how physicians can supplement to practice and help their patients heal more positively with peptide therapy. And thanks again, Dr. Kris, for being on the ROI Online podcast.
Thanks, Steve. Appreciate it.